Why are genetics key to detecting glaucoma early? Have you ever wondered how your genes might influence your eye health? When it comes to glaucoma, understanding genetics is crucial for early detection. Glaucoma is a complex disease that often runs in families, making genetic factors a key piece of the puzzle. This condition can develop silently, often without noticeable symptoms until significant vision loss occurs. This is why knowing your genetic risk can be a game changer. Glaucoma, particularly primary open-angle glaucoma, has a strong hereditary component. If you have a first-degree relative with glaucoma, your risk of developing the disease is about 9 times higher than that of someone without a family history. Specific genes, such as MYOC and CYP1B1, have been linked to increased glaucoma risk. These genes can be inherited in various ways, which means that understanding your family history is important. Recent advancements in genetic research have led to the development of polygenic risk scores. These scores combine information from multiple genetic variants to assess an individual's risk of developing glaucoma. By identifying people with higher genetic risk, healthcare providers can recommend more targeted screening and monitoring. This means that those at greater risk can be checked more frequently, allowing for earlier intervention. Elevated intraocular pressure is a major risk factor for glaucoma. Genetic studies have pinpointed specific areas in our DNA that influence how our bodies regulate this pressure. By detecting genetic markers related to elevated intraocular pressure, we can identify individuals at risk before any damage occurs to the optic nerve. This proactive approach can lead to timely treatments that help preserve vision. Incorporating genetic information into glaucoma screening can also improve efficiency. Traditional screening methods can sometimes yield false positives, leading to unnecessary stress and follow-ups for patients who are not actually at risk. By focusing on those with a higher genetic risk, healthcare providers can allocate resources more effectively, ensuring that those who need attention receive it promptly. It's also important to note that genetic risk profiles can vary among different ethnic groups. For example, individuals of African ancestry may have a higher risk of developing glaucoma. Ongoing research aims to refine genetic risk assessments to ensure they are applicable across diverse populations, making early detection more equitable. While genetic testing alone is not a definitive diagnostic tool, it is becoming increasingly integrated into clinical practice. As research continues, genetic insights may guide personalized treatment plans and preventive strategies. However, it is essential to combine genetic information with comprehensive examinations and professional care. In summary, genetics play a vital role in the early detection of glaucoma. They help identify individuals at risk before symptoms appear, improve screening accuracy, and support timely interventions. Understanding your genetic background can empower you to take proactive steps in managing your eye health. Always consult with healthcare professionals for personalized advice and care.